Hello students, today's video is about the clinical examination of the cranial nerve 7, 9, 10, 11 and 12. So 5 cranial nerves altogether. Now it is the last practical of lab 3 and you will have to perform this practical as well because it will be asked in your exam where you will have to perform in front of examiner, which is slightly difficult if you don't know it. So I have put a demonstration of the practical in this video as well. First of all, we'll go through the theory aspect of the practical, and then we'll see the practical aspect, that is demonstration of how to perform. Okay, so let's go through the theory aspect of the various cranial nerves one by one. Okay, the first one is seventh cranial nerve, that is also known as facial nerve. Now, any nerve contains two types of fibers, sensory or motor, or both. So accordingly it can be a motor nerve, sensory nerve or mixed nerve. Now the seventh cranial nerve is mixed nerve because it contains both types of components, motor as well as sensory. This nerve is originated from the pons. The motor component supplies various facial muscles. Apart from that, it also supplies various salivary glands like submandibular gland, sublingual gland, and apart from that various nasal glands and lacrimal glands also will be supplied by the seventh cranial nerve. Sensory component contains taste sensations from the anterior two-thirds of the tongue, not general sensations, because general sensations are carried by the fifth cranial nerve. So functions of seventh cranial nerve is to supply facial muscles which are required for the various facial expressions that we will examine, and to supply various salivary glands, and to carry out the taste sensations from the anterior two-thirds, not whole of the tongue, only from the anterior two-thirds of the tongue. That we will check it out. Okay, next is ninth cranial nerve, that is glossopharyngeal nerve. Now this one is also a mixed nerve, means it contains motor as well as sensory fibers. It is originated from the medulla. The motor fibers contains the fibers which will supply various pharyngeal muscles like medial constrictor of the pharynx, stylopharyngeus, etc. And it also contains fibers which will supply one salivary gland, that is parotid gland. Now sensory fibers just carry the signals test sensations from the posterior one-third of the tongue. As I have told you previously, the taste sensations from the anterior two-thirds of the tongue will be carried by the seventh cranial nerve, and the posterior one-third will be carried by the ninth cranial nerve. Okay, apart from that, it also carries signals from the carotid sinus and also carry the signals of the general sensations from the nasopharynx and posterior aspect of the soft palate. So the functions of the ninth cranial nerve is just, it will be useful in the swallowing, then it will just supply the parotid gland, so help in secretion of the saliva. It also carries taste sensation from the posterior one-third of the tongue, and it will be involved in the regulation of the blood pressure, that is baroreceptor reflex. Okay, the next one is 10th cranial nerve, that is vagus nerve, which is originated from the medulla oblongata. Now this nerve is also a mixed nerve, means it contains motor fibers as well as sensory. Now the motor components will supply most of the structures basically in the neck, thorax and abdomen. It supplies various muscles which are present in pharynx, larynx, soft palate, respiratory passages, most of the GI tract and heart. So most of the structures of neck, thorax and abdomen. And sensory fibers, it carries sensations from the aortic arch, around which various baroreceptors and chemoreceptors are present, so it will function in baroreceptor and chemoreceptor reflexes. It also carries general sensations from the various viscera which are present in thorax and abdomen. So the functions of 10th cranial nerve is to regulate various functions of the cardiovascular system, gastrointestinal system, respiratory system, urogenital tract, which are present in thorax and abdomen. And it is also involved in swallowing. Okay, so now we can't examine these functions directly, so what we'll do is we'll ask for various symptoms if they are present or not. For example, dysphagia, that is difficulty in swallowing, because vagus also supply various muscles of the pharynx which are used during swallowing. So if there is a paralysis of vagus now, then these muscles will not work, so patient will have difficulty in swallowing. So if swallowing is normal, then that means 10th cranial node is fine. Thus we will just examine it indirectly by asking for various symptoms if they are present or not. Okay, the next one is 11th cranial nerve, that is spinal accessory or simply accessory nerve. Now this one is pure motor, but it has two origins. One is cranial, which is from the medulla oblongata, and another from the spinal part, from the sixth cervical segment. Now this cranial origin supplies the various muscles of pharynx, larynx and soft palate, while the spinal part will supply two muscles. One is sternocleidomastoid and another one is trapezius. So the functions of this 11th cranial nerve is to just help during swallowing by the cranial part, and the spinal part will mediate head and shoulder movements, head by the sternocleidomastoid and shoulder movements will be mediated by the trapezius. Now cranial part will be examined along the vagus nerve, so you don't need to examine this cranial part separately. You have to just examine the spinal part, that is examination of these two muscles, sternocleidomastoid and trapezius. That's it. Okay, so the last one is 12th cranial nerve, that is hypoglossal nerve. This is also a pure motor nerve like 11th cranial nerve. It is originated from the medulla oblongata, and it will supply various muscles of the tongue on the same side, like hypoglossus, styloglossus, genioglossus, etc., etc. So the functions of this 12th cranial nerve is to help in movement of the tongue and therefore assist in speech and swallowing, and it will also assist in depressing the hyoid bone. So now examination of this 12th cranial nerve is very easy. We will just see for the movements of the tongue. Okay, so that's it. Okay, now about the applied aspect. Now the aim of today's clinical examination is to detect the abnormalities of these nerves and to localize the lesions at various levels. The lesions of cranial nerve may occur either in the supranuclear pathway, in the nucleus, or in the infranuclear pathway, that is in the nerves. Now the nuclear or infranuclear pulses can be either unilateral or bilateral, but the supranuclear palsy are mostly bilateral because of their bilateral cortical representation. Now first of all we will discuss 7th cranial nerve lesions. Now lesion of this fascial nerve is most common, not only among these 5 cranial nerves but among all the 12 cranial nerves, so it is most important. Now it can be either supranuclear or infranuclear fascial palsy. Infranuclear fascial palsy of idiopathic origin is also known as Bell's palsy. Supranuclear fascial palsy is very rare. Which is very common, most common is infranuclear fascial palsy. Okay, so now let's discuss first of all various effects of paralysis of this fascial nerve. First is affected side of the face loses its expression, nasolabial fold is less pronounced. Eye on the affected side is more widely open than on the other side and does not close totally even during sleep. The mouth is drawn to the healthy side. Food is collected between the lips and the gum on the affected side. Fluid and saliva escape from the affected angle of mouth. and there is loss of taste sensation from the anterior two-third of the tongue. However, if the lesion is below the joining of the chorda tympani now, then the taste sensation will not be affected. Okay, so these are the effects of paralysis of facial nerve. Now, how to differentiate between supranuclear and infranuclear facial palsy? There are some differences between these two palsies. Let's see few of them. Now, first, in supranuclear facial palsy, only lower part of the face is mainly affected, not of the upper part, which is case in infranuclear palsy. Infranuclear palsy, mostly both the parts, upper as well as lower part of the face, is affected. Now the second difference is taste sensations may not be altered in supranuclear facial palsy, but in case of infranuclear facial palsy, taste may be lost depending on the site of lesion. Now third difference is in case of supranuclear facial palsy, emotional component mostly is retained. Now there are two types of components, voluntary component and emotional component, which is involuntary. Voluntary component only is affected in case of supranuclear facial palsy. Emotional component is retained. So some of the facial expressions which are emotional may be visible in case of supranuclear facial palsy. In case of infranuclear facial palsy, both these components are lost, voluntary as well as emotional component. Okay, so there will be total paralysis of the affected side. Okay, so that is another difference. So these are the few differences between the supranuclear facial palsy and infranuclear facial palsy. Apart from this, other differences also has been written in your journal, so you can go through them. Okay, so that is all about the lesion of facial nerve or facial nerve paralysis. That's it. Okay, now the cranial nose. Next is lesion of glossopharyngeal nose. Now, as glossopharyngeal nerve carries fibers from the posterior one-third of the tongue, carrying taste sensation, so there will be loss of taste sensation from the posterior one-third of the tongue, and it also supplied to the pharyngeal muscles. So lesion of this glossopharyngeal nerve will lead to the abnormal pharyngeal reflexes, which leads to difficulty in swallowing. Then there will be decreased secretion of the saliva, as it also supplies to the parotid gland. Then orthostatic hypotension may occur because ninth cranial nerve also carries fibers from the carotid sinus, which contain baroreceptors. Okay, that's it. Next is lesion of vagus nerve. Now lesion of vagus nerve will lead to a loss of or abnormality of pharyngeal and palatal reflexes, so again there will be difficulty in swallowing. Now vagus nerve also supplies to various muscles of larynx and soft palate. It will lead to nasal regurgitation and uvula will deviate to healthy side. And because of this abnormality of laryngeal muscles, there will be a paralysis of vocal cord, so will lead to aphonia and may result in hoarseness of voice. Then there will be impairment of sensations from various organs of thorax and abdomen. Then as vagus nerve supplies parasympathetic supply to the heart, the lesion of vagus nerve may lead to increase in heart rate, because parasympathetic supply will cause decrease in heart rate. Then there will be impairment in regulation of blood pressure, because 10th cranial nerve carries signals from the aortic arch, which contains baroreceptors, so there will be impairment in regulation of the blood pressure. Next is lesion of spinal accessory nerve. Now cranial part will supply to various pharyngeal muscles, so lesion of the cranial part will lead to difficulty in swallowing. And then the spinal part, which supplies to two muscles, sternocleidomastoid and trapezius, so the lesion of the spinal part will lead to difficulty in turning the head, because sternocleidomastoid is used for that. and there will be difficulty to raise the shoulders. That is a function of trapezius, so there will be dropping of shoulders. Then the next is lesion of hypoglossal nerve. Now hypoglossal nerve will supply to various muscles of tongue, so lesion of the hypoglossal nerve will lead to the abnormality in various movements of the tongue. It can be either unilateral or bilateral. Unilateral lesion will lead to tongue is pushed to the paralyzed side. Median raphe will become concave towards the paralyzed side. Then there may be atrophy of tongue. There will be a fasciculation on the affected side, and dysarthria may be occur. Dysarthria means difficulty in speaking. Now bilateral paralysis will cause marked wasting with fasciculation on both the sides, and protrusion will become impossible. So these are the abnormality that you may observe in lesions of various cranial nerves. Okay, so that is all about the applied aspect. Okay, so theory part is over. Now I will show you practical demonstration of how to perform the clinical examination of 7, 9, 10, 11 and 12th cranial nerve one by one. This is one of the easy practical and needs no instrument except test solutions and rods. Now it is very easy to make those test solution at home. I'll explain it to you during demonstration, and instead of rods you can use the upper portion of the spoon, so you can just use the spoon making upper portion downwards. So perform this practical at home, which you can easily actually, because learning the performance by just watching the video is very difficult or almost impossible. Okay, so now the demonstration. Okay, now we will just go to the practical aspect, how to examine the cranial nerves. First of all, we will just go to the facial nerve, that is the 7th cranial nerve. Okay, so for the facial nerve, we will just check various facial muscles one by one. First of all, occipitofrontalis. Now, first of all, I will explain to you what to give the instruction to the subject. Then you have to give the instruction to subject in local language, because all the patients will be from the local area. So you have to give instruction in Gujarati, particularly for here in Jamnagar. Okay, so in the first occipitofrontalis, you have to tell subject to just raise his eyebrows or just to look upwards without moving his head. Okay, now we will check the frontal belly, only frontal belly of the occipitofrontalis. Occipitofrontalis has actually two bellies. One is frontal belly and one is occipital belly. You don't have to examine occipital belly, we will just examine frontal belly. Okay, so the first muscle. તારે ઉપર જોવાનું છે, માથું હલાવ્યા વગર. Okay, ચલો ઉપર જો. So now you have to see the wrinklings of the forehead. See, you can see these wrinklings over the forehead. So that means the frontal belly is contracted. Okay. So the second muscle, and that is procerus. Now for procerus you have to frown actually. So you have to see for the vertical folds between these two eyes, glabella, around the glabella. Okay. Okay, તારે છે ને ગરમ ગુસ્સે થવાનું છે થોડું. Okay, that you can observe the vertical folds around the glabella. Okay, so that is contraction of the procerus. Now the third muscle, that is orbicularis oculi. For that you have to remove the spectacles if he is wearing chashma kadi. Okay, then you have to just tell him to close his eyes, and you have to open, try to open, and you have to tell him to remain closed tightly. Okay, તારે આંખ એકદમ બંધ રાખવાની છે. હું ખોલવાની ટ્રાય કરીશ. ઓકે, જોરથી બંધ કરી દેજે. Okay, so I am not able to open his eyes. That means the orbicularis oculi is working properly. Okay, that is third muscle. Now the fourth muscle, levator labii superior. That for that we will just check for the nasolabial folds. So we will just tell him to smile or open this mouth widely. બરાબર છે, મોઢું એકદમ આમ વાઇડલી ઓપન કર. Okay, so here you can see the nasolabial folds. That shows that the contraction of the levator labii is occurring. Okay, so that is the fourth muscle. Then we'll just check the contraction of the orbicularis oris. For that you have to tell him to whistle. So whistle કરતા આવડે છે? Whistle કરજો. Okay. Okay, as you can see, he is whistling properly, so orbicularis oris is working properly. Now we will just check the buccinator muscle. For buccinator, we will just tell him to inflate anything. Just fill the air inside his mouth and we will just tap around the cheek so that the air will not come out from the mouth. Okay. મોઢામાં હવા ભરતે. Okay, so he is just closing his mouth tightly. He can able to close the mouth tightly, so air is not coming out of the mouth, so the buccinator is working properly. Now we will just check the muscle platysma, which is here from the lower part of the mandible to the upper part of the clavicle. So that is very wide muscles. Okay, so now we will tell him to clench his teeth. Okay, so this muscle will slightly become prominent. एकदम भीस दांत ने. Okay, as you can see some contraction has been occurring here over the neck area. So you can see the movements in the neck area, that is platysma. Okay, now the last muscle is stapedius. For that you can't examine directly. You have to just tell him to ask him if he is hearing properly in loud sound or not. Okay, because muscle function of the stapedius muscle is to prevent the loud sound to enter inside the ear. Okay, જ્યારે બહુ મોટો અવાજ આવે છે ત્યારે તને બરાબર સંભળાય છે? Okay, so if he is hearing properly even in loud sound, that means the stapedius is working properly. Okay, so these are the various muscles of the facial expression. Actually there are so many muscles apart from these muscles, but we will just examine these muscles and we will just get an idea whether facial nerve is working properly or not. So you have to compare the movements of the muscles bilaterally. So you have to examine muscles of both the sides simultaneously. Okay, so you have to see folds in left side as well as right side in all these muscles. Okay, so muscles of the both side will be examined simultaneously and you have to actually compare the movements on the both the sides. So if there is a lack of movement over the one side, then you can just infer that paralysis of the one side has occurred. Okay, so that is examination of the facial nerve, motor part of the facial nerve. Now we will examine the sensory part of the facial nerve. Sensory part actually carried sensation from the anterior two-third of the tongue for the taste sensation. So we will check the taste sensation in the anterior two-third of the tongue. Along with that, we will also examine posterior one-third also. So the glossopharyngeal nerve also will be examined along with the sensory part of the facial nerve. Okay, so for that we have 4 solutions made: sweet, sour, salty and bitter. Okay, now sweet has been formed from the glucose, sour from the lemon, salty from the salt and bitter from the tablet chlorophyll. Okay, now 4 solution has 4 rods. You don't have to mix up the rods. You have to use this rod of salty only for the salt solution. You have to put 1 or 2 drops over the tongue of the patient. Okay, for any particular substance. Now you don't have to tell him to see at the rod, or you have to tell him to close his eyes. Then you have to put a drop and he has to put tongue outside. He is not allowed to tongue put inside the mouth. Okay, then he has to just sign over the 4 signs if he is able to identify, like this 4. So he has to put his finger which test we have put over his tongue. Okay, so now there is one thumb rule that the test buds for the sweet are more over the tip of the tongue, for the salt and sour over the lateral side, and for the bitter over the posterior aspect. But you have to put drop anywhere over the tongue
Okay, but this just keep in your mind so that you must know where to put which drop. Okay, first of all, you have to put drops on the sweet, sour or salt. You have to use this bitter test in last always, because bitter is slightly stronger test sensation. So if you use bitter first of all, then it will obscure all the other three. And you have to keep in your mind while performing this test sensation, after putting a drop, you have to tell him to rinse his mouth for each and every time. Okay, so for each and every sensation you have to rinse his mouth every time. Okay, so we'll not do this this time, but this you have to keep in your mind. Okay, આંખ બંધ કરી દે તારી, જીભ બહાર કાઢ, આખી મોઢું ખોલ નાખ અને આખી જીભ બહાર કાઢ. ઓકે, sweet, yes, sweet it is, as you can see here. Okay, so likewise you have to put randomly and its test sensation among three: sweet, sour or salt. Not use bitter in first three, you have to use bitter at the last. Likewise, okay, you have to put this drop anywhere in anterior 2/3 or in posterior 1/3, left side as well as right side. So you have to actually divide this tongue in 4 areas: left, right, anterior 2/3, left, right, posterior 1/3. Okay, in all the 4 areas you have to put these 4 test solutions drop by drop. Okay, so that's it. Now 7th as well as 8th cranial nerve will be examined simultaneously. Then we will go to the 10th cranial nerve, that is vagus. For the vagus you have to just look for the various symptoms, like if he is able to swallow properly, if there is any difficulty in speaking, swallowing or nasal regurgitation or present or not. નાકમાં ઘણી વાર આવી જાય છે ખાવાનું, નથી આવતું. ખાવામાં ગળે ઉતારવામાં કંઈ પ્રોબ્લેમ થાય છે, નથી થતો. બોલવામાં કંઈ પ્રોબ્લેમ થાય છે. ઓકે, then you have to check for the nasal twang, that is exaggerated nasality in the quality of the sound. If there is a change in quality of sound, that you have to look for, you have to ask for the relatives basically. Okay, so these are the symptoms. Then you have to look for the movements of the uvula and soft palate. So you have to just tell him to open his mouth and to say ah. Okay, so there will be movement of uvula, that you have to look for. Okay, I will just show you. Okay, મોઢું ખોલ એકદમ પૂરું. Okay, now say ah. Yes, if you can able to see, bol ah. Okay, so there will be movement of a soft palate and uvula like this. Uvula will be like this. Okay, so the soft palate and uvula will move. So the movement must occur symmetrical bilaterally. Okay, uvula must not be distracted toward the one side, and the soft palate must be moved bilaterally symmetrical. That you have to check for, because in the case of paralysis of one side soft palate will move, but the other side will remain lax. Okay, so that you have to check for. Okay, so that is 10th cranial nerve. Apart from that, one reflex is there, oculocardiac reflex, in which you have to give pressure over the eyeball, so that will cause decrease in heart rate, inhibition of the heart actually. That you don't have to examine. Okay, so that is just for your knowledge. Apart from that, everything you have to examine. Okay, so that is examination of the 10th cranial nerve. Now we will examine 11th cranial nerve, that is spinal SSA. Now cranial part of the spinal SSA now will be examined along with the 10th, that is swallowing and everything. But this spinal part will be examined by examination of the 2 muscles. First of all, trapezius. For trapezius, you have to just tell him to shrug his shoulder like this, to raise his shoulder, and you have to give pressure in the opposite direction. So he has to raise his shoulder against some resistance that you will give. Okay, so okay, so he is able to shrug slightly, થોડા વધારે હજી બરાબર છે. So he is able to shrug his shoulder, so that means grade is 5, as you have examined in motor system. So you have to just give the gradation of these muscles. So this is trapezius. Now sternocleidomastoid, એક બાજુ જો. Okay, as you can see this one is prominent sternocleidomastoid. Now you have to give resistance here and then you have to tell him to move his head towards the opposite side. બીજી બાજુ જો હજી જરા જોરથી. Okay, so as you can see this sternocleidomastoid will become slightly prominent. Okay, you have to feel this sternocleidomastoid. Okay, that's it. Okay, આ બાજુ જો. Yes, as you can see this is the opposite sternocleidomastoid. Okay, જો આ બાજુ પાછું. See, this sternocleidomastoid will become prominent. Okay, so you have to check for the prominence of this sternocleidomastoid muscle. So both are prominent, so that means they are G5. So that is examination of the 11th cranial nerve. Now we will examine 12th cranial nerve, that is hypoglossal. For that you have to examine first of all movement of the tongue. You have to tell him to just put this tongue out. If it is in the center exactly, that means it is normal. If it is deviated toward the one side, that means there is abnormality. In case of paralysis of the one side, it will be pushed towards the paralyzed side. Okay, so sorry, tip bar cut. Okay, so it is exactly in the midline. You have to see it for the midline raphe. It should be exactly parallel. Okay, if it is curved towards the one side, the concave portion will be towards the paralyzed side. Then you have to just tell him to move sideways. Okay, so he is able to move left and right. Then you just tell him to move his tongue opposite to the cheek. જીભથી તારા ગલોફાને આમ મૂવ કર અંદરની બાજુથી. Okay, so he is able to move around the cheek. So the movement of the tongue is normal, so that means hypoglossal nerve is normal. So that is examination of the 12th cranial nerve. Okay, so the practical aspect of this exercise is over. Now I want to give some instruction for this practical aspect. One is you can perform this practical at home. I will just show you each of the observation that you have to take. See, if you have not taken your journal at home, okay, then these are the observation tables that you have to take. Okay, we will just discuss one by one what you have to write down first of all. Now in case of 7th cranial, now see, you have to write down just grade of power of the muscle, that is that will be G5, and inference, that is pathway intact in all the muscles. Then in sensory part you have to check sensations, various sensations, left side and right side, and inference, that will be pathway intact in all the 4 sensations. Then ninth cranial now will be examined along the sensory part of the 7th. You have to write down if integrity of the 9th is intact or not. Okay, so you have here if it is intact, then you have to write down intact. Then 10th cranial now you have to observe various symptoms like nasal regurgitation, dysphagia, dysphonia, nasal twang, and then you have to check for the movements of cleft palate and uvula. Oculocardiac reflex you don't have to examine. Here you have to write down all the observation. If it is present, then you have to write down present. If it is absent, then you have to write down absent. Then 11th cranial nerve. In 11th cranial nerve, you have to write down the gradation of these 2 muscles, trapezius and sternocleidomastoid. In 12th cranial nerve, you have to see for the tongue position in the protrusion, that will be in the midline. In case of normal person, side to side movement, cheek licking. Okay, and abnormalities if they are present. Okay, so that's it. These are the observation tables that you have to write down. Then some instruction, you can perform this practical at home also, or anybody who is present in your home. For that you need just these 4 solutions, that's it. These 4 solutions you can make at home from various substances which are present in your home. For the sweet, you can use sugar. Just simple 1 teaspoon sugar, add in the water and just mix it. Okay, so that is sweet solution. For the salty solution, you can use salt. Just add salt in some water and that will be your salt solution. In case of sour, you have to use lemon. Just pour lemon and you can use as a sour solution. Don't add water inside the lemon, otherwise it will just slightly dilute it. For bitter, you have to use chloroquine. If you have tablet of chloroquine or any other antibiotics, you can just dilute it inside the water and you can mix it inside the water. That will be a bitter. Okay, so that's it. So you can use this 4 solution, you can make this 4 solution at home and you can use them. Okay, this one is a solution of KMNO4. This is just to disinfect these rods after using in a single person. If you want to use or the other person, then you have to disinfect every time. Okay, but if you want to use only in one person, then there is no need of this KMNO4 solution. Okay, so this one is KMNO4 solution. Okay, so you can perform this practical at home. Actually, you don't need a subject apart from this test and session. You can perform this examination of all the muscles over you also. You just sit over the opposite of the mirror and you can observe the movements of your facial muscles in mirror. Okay, so you don't need subject also for the examination of all these facial muscles or all this muscle of 11th cranial nerve or 12th cranial nerve. Just for the examination of these 4 test sensation, you need a subject. Okay, so that's it. So make anybody a subject and then you can use this 4 test solution over him. Okay, so that's it. So if you have any query, then you can go through this video again. Otherwise, you can perform this practical at home also. Okay, so that's it. Thank you.